Going to take thoracolumbar. Okay, thoracolumbar spine we'll see. So here we know the movements. What movements we are having here? Thoracolumbar spine. Here we will be having first one flexion. We are having extension. We are having. After that we are having side. No, please. Look at. Okay. Now we will see here side flexion we will be having. After that we will be having rotation. So these are the movements we are having. So first we will see first we will see flexion movement. So to measure this with goniometer, okay. So we will see here. So first we have to mark T1 here. How to mark T1? We know. We'll ask patient to go for flexion. If patient goes for cervical spine flexion, here we can see C7 exactly. Here after C7 we will be having interspinous space. Then this is our T1. So this is our T1. So it's clear. We mark here T1. So from T1 here we have to measure up to L5. We have to take. So here we have two options. The first option. So we'll see here. We'll palpate the 12th rib. So after that we'll come just with the 12th rib. Then here we are going to feel the T12. Exactly 12th rib, lower rib cage, 12th rib. Here we'll feel the T12. After T12 we can ask patient to go for flexion. Then here T12 we will measure here this interspinous distance L1, L2, L3, L4, L5. So here we will come up to L5. So this is our L5 spine. So here we will mark the T1. This is our T1 spinous process. After we have to here mark the L5. L5 we discussed through T12, mean from rib cage will come to T12, will come down. So this is our 2 marks. So here we have to mark these 2 points. Now we are going to measure the thoracolumbar flexion. First we should take a distance between T1 spinous process to the L5 spinous process. So this will measure how much distance it comes. This we are going to measure this distance. Then after that come face equal. After that again we are going to take the same distance. Here we will ask patient to go for flexion. Here patient will go for flexion, how much he can do. So here the distance between these two spinous process will increase. So how many centimeters it increased, that is his thoracolumbar spine flexion. Okay. Now we will see extension. Extension also same. First we are going to take the measurement between these two spinous process. Okay, a measurement between these two spinous process. Okay, after that we should ask patient to go for extension. So now we wait. So here I mark. Now I'll ask patient to come to extension. When patient comes to extension, so the distance will reduce. Relax. The distance will reduce. How many centimeter the distance will reduce? That is his spine, thoracolumbar spine extension. Now we will see side flexion. Okay. So now we are going to measure it with what is this? Goniometer. We are going to measure it with goniometer. So now we will see. This is our L5. So just behind L5 we will be having its spinous processor. S1. After that S2. So the fulcrum for this movement we are going to keep our fulcrum over the S2, and move along over the spinous process of the lumbar thoracic spine. Okay. This is our stabulum. So before doing this, first we will ask patient to do one side lateral flexion. Patient will do lateral flexion. Okay. So that whenever you ask while measuring, he will do easy. So here we are going to keep it. Then we'll ask patient to go for side flexion. Then we'll ask patient to go for side flexion. That's it. See here spinous process are there. We are going to just lateral to the spinous process. This spinous process. Then here relax. Then here we will measure the distance. How much it will come. That distance we will measure. So that is his lateral flexion. That is his lateral flexion. Now lateral flexion we are having two. First we are going to keep your hand like this. First we are going to take the distance between. See, middle finger. Take the distance between tip of the middle finger to the floor. Tip of the middle finger to the floor. Tip of the middle finger to the floor. So this we will take the distance first. After that, we'll ask patient to go for flexion, side flexion. When patient goes for side flexion, here we are going to take the again same distance between middle finger to the floor, Then we can tell what is the side flexion range. Relax. What is the side flexion range? Take that marker back. So one more method. So here patient will be in this position. So keep your hand. So when patient neutral. When patient is in neutral position, we are going to make one mark over the thigh at the end of the tip of the middle finger. Then we'll ask patient to go for side flexion. When patient goes for side flexion, same tip of the middle finger will take the one mark. Then the distance between these two, these two marks also will take. This is also one more method to measure range of motion with our inch tip. Okay. Yes. Now. Okay. See, now rotation we are going to measure. We know how to measure cervical rotation. Like this, we measure cervical rotation. Now here we are going to measure the full body rotation. Here, thoracic spine, lumbar spine will involve. So, patient will be in high sitting position. Here we have to keep our fulcrum over the center of the cranium. Will keep. Movable arm, stable arm will be on same place. Okay. So, it will come exactly to the acromion process. Here the point is, this acromion process is exactly above the iliac crest. This acromion process is exactly above the iliac crest. Understand? So after here we are going to ask the patient to do rotation. Now I am going to move the movable arm. The movable arm with corresponding to the acromion process. What the point is, this movable arm should be straight to the acromion process. So this is stable arm. Okay, leave stable arm. Now I am asking patient to do rotation by hold it. So here movement will be like this. So patient firstly he will go on that neutral position. That time it was corresponding resting acromion. Now he did rotation. Now this movable arm is exactly corresponding to this acromion process. So we will measure the distance, how much it will come, the range, how much range. So that is our rotation. Here. The thoracic spine, lumbar spine together extension we are going to measure with the inch tape. So to check that, we will ask patient to first, okay, lift your, do extension. So patient has to do extension like this. First we will do passive. Okay, relax. First we will do passively so that patient will understand what is this extension movement. So now we will ask patient to go for. I need one more therapist. Alvin, come. Jaldi. Just stabilize his pelvis. So we have to stabilize the pelvis. Then we will ask patient to go for extension. When patient goes for extension, we are going to take the distance between sternal notch to the exactly bed. So then we will tell this is the extension range of this patient. Now we will see flexion. Okay, stand. That's it. Stand. So now we will see flexion how to measure. We will ask patient, already patient knows what is flexion. We will ask patient to go for flexion. Keep your things like this. So usually when patient do flexion, here is full flexible. He touches the floor. Suppose if the patients are like this, so here we are going to measure the distance between tip of the middle finger to the toe. Tip of the middle finger to the what is this? Floor. Okay. So here we have to measure the distance. Tip of the middle finger to the floor. So do your complete flexion. Here we did complete. If there is no floor, he can bend little more also, I think. Okay. Okay, so this is the way how to measure thoracolumbar spine flexion, extension. Now